So earlier on we looked at menorrhagia. So we got to see that menorrhagia is like a woman is bleeding too much. That's during menstruation. So she's having a normal menstruation during her normal menstrual period, but the bleeding is actually too much. You understand? So of course, if somebody is losing blood, it's just like you had an accident and you're losing blood. It's the same blood you are losing. You understand? You are still prone to having what? Anemia. Do you understand? So this is just to tell you that some women can actually lose blood for a very long time, till they actually tilt into anemia. Okay? So looking at this, we just say that anemia in menorrhagia is common. You understand? So it's often under-recognized. Like the way I'm talking about this thing here, some people don't really take it as a priority. Alright? So it's a consequence of the woman bleeding heavily during menstruation time. So when periods are excessive or long or heavy, the body loses more blood than it is making, leading to iron deficiency anemia. Right? So that's the most frequent type of anemia in women that menstruate. Okay? So there's excessive blood loss, usually depletes iron stores needed to produce hemoglobin. Hemoglobin is a protein in what? Red blood cells that carries oxygen to tissues. So without enough iron, the body can't make sufficient red blood cells. So the woman is weak. The woman is what? She's finding it hard to breathe. Not enough oxygen for cells. So for symptoms you see in people that are approaching anemia in menorrhagia, they are tired or drained, their skins are pale. If you ask them to open their mouth, the gums are pale too. So dizziness or lightheadedness, rapid heartbeats or palpitations, shortness of breath. They are craving for non-food items like clay. That's a pica condition, pica syndrome. So their hair, they're also losing hair. So for the next thing which we are looking at, diagnosis, complete blood counts. You want to check out that, okay, this blood is actually little. Iron studies like serum ferritin, transferrin, menstrual history, because you want to access the volume of blood the person has lost, right? Pelvic ultrasound to identify conditions like fibroids, polyps. Okay, so how about the treatment options? First of all, you need to address anemia. Okay, so for anemia, you give iron to the person. All right, dietary changes. They should be eating iron-rich food, iron-containing food, like red meat, spinach, lentils, fortified cereals. Vitamin C to enhance iron absorption. So for menorrhagia, that means the person is actually losing blood so much. Hormonal therapies, okay, tranexamic acid, right, and all of that. If you are dealing with polyps or cancer, then surgery can actually come in.